washed my hands before entering the hospital, and I verified the need that Mr. Smith needs an NG tube. So I have all my supplies scattered here. Now I'm just gonna go in the room. Hi, Mr. Smith. How are you doing today?
Good.
Good. All right. So I have an order that you need an NG tube. Do you know what that is, or have you ever had one?
No.
All right. So it's a tube that's gonna go into your stomach through your nose. It's gonna be a little painful. I'm just gonna be straight up with you. It's gonna hurt a little bit, but I'm gonna be here. I'm gonna have another nurse come in here and help you get it in. I've also assessed his lung sounds and his bowel sounds, and they're all active, and his lung sounds aren't diminished. All right, so are you ready? Ready to get started? Okay. So I'm just gonna raise the bed to a working height. And then I'm gonna raise the bed to high Fowler's position. And I'm gonna get a towel and put this over Mr. Smith. And this isn't a sterile procedure, so I can just practice aseptic technique. I also have this hemolysis basin for Mr. Smith if he gets sick. I have a glass of water for him. I have my tube. And then I'm just going to measure from his mouth to his ear. Alright, and then I'm going to go down the xiphoid process.
Get you some support.
Alright, it's about 55, so I'm going to mark that with my hands. Alright, I'm going to have my assistant nurse come in. Alright, Mr. Joe, Mr. Smith, we're going to sit you up. And when I tell you to swallow, you're gonna have to swallow a lot, okay? And this is not gonna feel very good, okay?
Okay.
All right, and then I would get my lube as well. About 4 inches. Okay. I'm gonna start inserting it, Mr. Smith, okay?
Okay.
All right, Mr. Smith, you're gonna swallow, swallow, swallow.
Now that I've got you on your side with 3 pillows for support, I'm going to cover you back up.
Alright, let me check his mouth, make sure it's not in there. It's not in there. Alright. And then, alright, you can lay back down.
Any discomfort?
Alright, and then I would secure it. I would order a chest x-ray to make sure it's not going into his lungs. And then I would get my syringe.
Nice and comfy, ready for bed?
To get out some gastric secretion. Alright, I would put it in here. And then I would test the pH of it to make sure it's in the stomach as well, if I can grab it. Alright. See the color, it's about a 2, so it's acidic. Alright, so the procedure is completed. I would document the procedure, how it went, any issues went with it. I would document the pH of that secretion, and then I would lower the head of the bed a little bit, since he has that tube, and I would try to keep it up more. And I would lower his bed to lowest position possible for safety.
Alright, bye, Mr. Smith. Alright, now I'm going to doff my PPE. First thing I'm going to do is remove my gloves.
Take everything out, and then that is inserting an NG tube. Alright, I forgot to ask Mr. Smith's name and date of birth. So, alright, Mr. Smith, can you tell me your name and date of birth for me?
Joe Smith, 9/19/76.